All right. Thank you for that. Glad to be here. Excited to entertain any questions you guys have. I am going to keep this fairly high level, and we'll save some of the details for the question and answer session. I am going to start out with a real quick system history. What has our system done with mycoplasma over the course of the years here? And then I'm really going to focus on what are the lessons learned. What have we learned from dealing with it, and what are we going to proceed with as we go? So starting in 2012, the Maschhoffs system was very unstable for mycoplasma. We had lots of different statuses, a lot of clinical signs in finishing, and frankly it was hurting our bottom line from a production standpoint. So starting in 2015, we embarked on elimination. The exact protocols that Dr. Yeske was talking about, we proceeded with those. We started in our multiplication pyramid and worked our way down all the way to the commercial level. So that takes a few years. We did do whole herd closures and medication plans, and then we began to eliminate it in the commercial sows. As we embarked on that, we were, as of last year, it would have been about 160,000 sows would have been mycoplasma negative within our system, or at least at the tail end of a closure. Now we are at the point that we are starting to identify anything that was not a successful elimination, anything that is what we would call a rebreak or a failure of elimination, and then what do we do about it? What do you do once you've already tried to get rid of it and now you've got some positives? So all of the farms would have used a fairly standard plan, but again, lots of variability across the sow farms. Anytime you get 60 sow farms, you're going to have the need to change things and adjust things. So they would have all loaded up. They would have had a lot of variation on the length of closure, whether that be 35, 40 plus weeks, was PERS involved, lots of variables there. Probably the most variability would have been the medication and vaccination plans. So all the piglets would have been injected with an antibiotic. That was pretty standard. We would have used a whole herd vaccination plan. And then there's a lot of variation on which medications we used. We have what we call the $10 per sow program, right? And that was just medication in the feed and water for the sows, all the way up to a $40 plan and anything in between. So each of those farms would have used somewhat of a different plan, all with the same goal in mind. So we've got a lot to compare on what works and what doesn't work within the system. So we are 3 years out on our multiplication eliminations, and those would have been, today, still all negative. Granted, we didn't cut corners at all when it came to multiplication, right? 40 weeks, full $40 sow program, we used it all. We didn't want to have the failure rate was not an option on the multiplication side. On the commercial side, we got a little more creative, right? Where can we save money? Where does it pay? And so we have one region with 16 sow farms that would be 15 months out from elimination. And the ones that use the $10 program have a 57% success rate, so very different from 100%. Now, I would still argue that $3 to $5 a pig, we've captured that $3 to $5 a pig for 15 plus months on those farms. So we may not have been successful in terms of being naive or staying negative. We still got a return on investment on that $10 program. So that's pretty important to keep in mind, is what is your end goal? If you want a naive negative population that doesn't return, you probably shouldn't sign up for a $10 program. If you're okay and you want to capture the finishing end, which means you're going to capture $3 to $5 a head on finishing because of mortality, feed conversion, all of those things, the $10 program can still pay. Our $40 program, we're still at 100% success rate. However, we're only 9 to 12 months out. So we got some time on those farms that we don't expect to be 100% on that one either. There were still some creative things that we did there to continue to get production out of those farms that may make us not be 100%. All right, so what did we learn? Right, we've had a few failures now. We're 9 to 12 months after this. What have we changed over the course of the time? There's a bunch of different items. So testing is one of them. Dr. Yeske talked about this a little bit on technique being very important. We do zero oral fluids. We do zero serum. It's all tracheal swabs. And he mentioned day zero a little bit. Day zero is when all of your gilt population is positive. And one of the reasons that we think our $10 program was not successful was because we weren't very sure on day zero. We had some that just had intratracheal exposure, and it wasn't all of them. We didn't test far enough out. So how long does it take to get to day zero? I would tell you our lesson learned is minimum 4 weeks, but even at 4 weeks, you better be testing because you're still probably going to find negatives at 4 weeks after you expose those animals. So getting to 100% positive is pretty crucial on what plan you use. and it happens much slower than you would think. I also mentioned method and technique, right? So when we do a tracheal swab, it's not just it's got to be in the trachea. There's a technique to it. If you're in the wrong place, you'll be negative all day long. So if you're going to have field people do this, you've got to make darn sure they understand that if you're not in the trachea, which is very easy to go somewhere else, there's an esophagus that sits there too, and you'll be negative all day long and think you're good, and you're definitely not negative. So we've kind of adjusted our tools that we use in the field. So if you're going to use the visual method, which you can kind of see in the picture on the top right there, that they're using a speculum, right? They've got a swab, but somebody's not doing that blindly. They're using their eyes to do it. Get a good headlamp. Especially if you're training somebody, that's going to help them visualize what they're seeing and where they're going with that swab. Get the right size speculum, not too big, not too small. And then the other key is the swab that you use. Sometimes we will come up with negative if we don't have a good swab. Even if you think you're in the trachea, if your swab isn't deep enough or long enough, you didn't get a very good swab. So we've started to use either red rubber catheter in small pigs, or we'll take a PCAI rod, and you can actually see right here, that's a PCAI rod, and then we've cut a Q-tip off or a different type of swab, and you stick it in the end there. That gives you a lot of length to get really deep in that animal. And some of these farms that I'm quoting a failure rate, those 57% success ones, we think we caught those infections very early because of this technique. So there's different tools that you can use to make sure you're getting the best sample and you're sure that you're actually negative. So closure length. I mentioned we have some variation out there. If you're going to do a shorter closure length, you've got to be 100% sure on that day zero. That's lesson learned. Those 35-weekers plus a $10 program, we weren't very sure on day zero. So if we were to repeat that program, we need to be really sure what day zero is, what exposure method we used, and what testing we did. Herd stability, know where your herd is at, so you actually need to test the herd before you go. We didn't actually do some of that as well. And you've got to accept a little bit of a higher failure rate. Again, you've got to keep what your purpose end is in mind. If your purpose is 100% negative, I would not sign up for a 35-week program. So we've moved to a 40-week on the ones that we do not want to accept a failure this time around. You can churn a 35-week closure all day long if you're going to capture the finishing end of it. It absolutely pays. I would not doubt that for a second, but you might not stay negative 1 to 2 years out. The other key on this is going to be breed target, right? A 40-week closure sounds all great on paper, but if you don't have the means to continue to hit breed target, nobody's going to sign up for this. You've got to be able to orchestrate a breed project and execute it well, or figure out how you're going to get those breeds done elsewhere. Because a 40-week closure generally doesn't pay if you miss breed target for all those weeks. Exposure methods. Dr. Yeske mentioned this, so I'm not going to go real heavily into it, but intratracheal exposure is great in one animal. Works great in that one animal, but it takes them a really long time to spread. Some of our closures that we would have done intratracheal, and we would have exposed a certain amount and then hoped that they shed it to the rest. It doesn't work. We've gone in and tested 250-pound gilts where we intratracheal expose 10 in every pen, and there's still negatives there. So we've moved to exclusively fogging, which we run it through the hurricane fogger. There's lots of specifics on that. I'm going to hold that for the questions if anyone wants more details or ask me afterwards. But there's a lot of details on how do you get a farm fogged successfully. What stuff do you use? What airspace do you use? How long do you fog it? All of those details matter on fogging. The last component is what do you do once you've found a rebreak? And I would tell you that we've looked at all of our rebreaks very heavily, and not one of them has been lateral or come in from the outside. They were just failures of elimination. We didn't knock the bug down and actually eliminate it. We knocked it down low enough so it took a while, and then once it's up there, now we find it again. We have not moved Mycoplasma into a herd at all. It's very, very hard to do. In fact, we've moved positive animals into gilt populations trying to make them positive, and they won't go positive. So dragging it in from a biosecurity perspective, guys, the risk is low. We're placing a lot of these negative animals straight in the heart of Iowa, and they're staying negative. We vaccinate them, but we are not having massive Mycoplasma disease in these negative animals. In fact, they're performing 2 to 3% grade A better than what they were previously. Sequence, we are sequencing everything. Does it matter? I'd say we don't know yet. We probably don't have enough science behind that to know at what % does it matter, but what I can tell you is that out of the 20 or so sequences that we've got on Mycoplasma, everything that we would have used as an exposure, it's all the same, within a % of each other. And so we did sequence one external Mycoplasma that we brought in on a positive source, knowing that we did that, and it was almost 2% different. So there is a difference on sequence. I think we just, at this point, don't understand exactly what matters, but I would continue to sequence because we are starting to learn that there are differences out there, and that may matter in the future here. And it at least helps us understand, did it come in from the outside or is it the exact same strain? So we can understand the dynamics of a rebreak if we sequence. Fogging the sow farm is something that we've started to do. So when I was talking about exposure previously, I'm talking about the gilt population, right? What do we do with that population that we're going to enter? We've started to fog sow farms now. So if a sow farm rebreaks, we want to get that farm over the disease as fast as possible. And we were preparing for production losses when we fogged the sow farm, to be honest, right? Is it going to have an impact? It turned the ventilation off. What's going to happen? And I would tell you we've seen minimal. A slight maybe uptick in recycles in certain groups. We actually did fog all of our farrowing houses as well, which means all those piglets were in the farrowing house when we did it. I tell you they're performing exactly the same as their counterparts who were not there. So we did do some preventative things to try and manage that, right, treating the piglets and such. But so far, the losses relative to fogging a farm, we have not blown up disease. We haven't had sow mortality. We haven't had major issues there. Once we do fog them, there's always the question, should we medicate that farm? And I would tell you, none of our farms were negative enough to need medicating. We didn't have sow mortality. We didn't have issues. We caught it. Maybe gilts were coughing a little bit. But our mindset on the medication, at least on the forefront, is we want them to go positive, and we don't want pockets of negative animals. So we have chosen to not medicate those farms as we've done that. And so far, it has worked pretty well. So real quick summary on what have we changed and what have we learned. So fogging the sow farm, right? We started by exposing gilts and making sure our gilt population is good. We've now moved to making sure the sow farm is on the exact same path as the gilts, which means we're exposing the full sow farm now. Day 0 testing, we're starting to move that further out. So instead of saying 2 weeks, 4 weeks, we're starting to test those and make darn sure there's no negative animals there. And sometimes that's beyond 4 weeks. So that's something you've got to plan for relative to timeline and breed projects and all of those things that go along with this. We've moved to almost exclusively 40 weeks in length. That kind of goes back with our history, though, that most of our 35-weekers were not terribly successful, and so they're not willing to accept a failure this time. They want to be done with it. And then adult animal injections, we did drop that out on some of those cheaper closure programs, and we're not choosing to drop that anymore. So we're putting those back into the adults as well when we do a closure. So this is my team that helped me do this. This is certainly not all my undertaking, and we've got a team of very talented veterinarians that help lead the charge here, and I'm going to hold any questions until the end.